Hello, my name is Carol Iovino, and today we are going to do a photo facial with a microdermabrasion. We have the Diamond Tone microdermabrasion machine. It's a crystal-free medical machine that is the gold standard for microdermabrasion. And what we want to do is take off that top layer of dead skin cells so that we can leave the skin open for moisture, and it will receive the photo facial better. So we're going to get started. We have a medium head. Tips of the head are made of diamond chips, and it scrapes along the skin and allows the skin to be exfoliated. So we start on the forehead. A lot of times when we're moisturizing our skin and everybody says it's very dry, sometimes it is because you're just moisturizing dead skin cells. So having a microdermabrasion on a monthly basis is really wonderful for the skin cells turnover. Microdermabrasion is also good for reducing fine lines and wrinkles, and for helping lighten and brighten the skin. If you add a chemical peel after you're finished with your microdermabrasion, it just kicks it up a notch and does a really wonderful job. It's great for anti-aging. I've been doing microdermabrasions and peels on myself for years. You don't always have to do a treatment with downtime in order to get the results that you want to get. Now Jill has some little tiny cuprose veins on her cheeks, so we're not going to do the microdermabrasion over her cheeks for very long. We just do one quick swipe, and then we're going to take out the yag and work on the veins in the cheeks. So we do 2 passes with the microderm, and then we will get into the photo facial. Two quick passes with the microderm opens up the skin. So now we're going to do a photo facial, which is intense pulse light. The first thing we're going to use is the yag and work on the veins in the face. She's got a couple of veins on her chin and a couple of veins in her cheeks. And this will cauterize those veins and close them up. And we will know in a month if they stay closed or if they open back up. Then we will probably retreat. Whenever you do photo facials, you're going to want anywhere from 3 to 5 treatments in order to get the results that you need. This is the yag. We use the Cutera laser, and this is going to trace out the little tiny veins in Jill's face. This is the first step for the photo facial. A lot of places and other businesses do not do this step in their photo facial. This is something that we do here at Dr. Stile's office. It kicks our treatments up just a notch. So Jill, we're gonna just trace out a couple of these little veins right here. The tip of this laser is very, very cold. It prepares the skin for the heat. And we're gonna go 1, 2, 3. And we just hit these little veins. Doing all right? Okay. 1, 2, 3. Nice. Some of them are disappearing, and some of them may be a little bit stubborn. You can do this treatment as often as once a month. And like I said, sometimes it takes several treatments to get the results you're looking for. This particular treatment is wonderful for rosacea also. All right, you ready? Okay. You may get a little black and blue. That's just part of what happens sometimes when we're doing the YAG. You can cover it with makeup tomorrow. You all right? And of course we cover our clients' eyes and use our safety glasses. Ready? 1, 2, 3. That was nice. The nose tends to be a little more sensitive. Not too bad, Jill? Jill's one of my favorite patients. All right, nice. So that we only go over one time. We don't want to retreat the first go round, and you don't always get all the veins in the first treatment. But the next thing we're going to do is the IPL. This is the intense pulse light. This is the part, this works for background redness, sun damage, helps get rid of those brown spots everybody complains about, because spots only look good in nature, not on our faces. This also works for rosacea. You pretty much need 5 treatments for rosacea to get rid of that background redness. Doing all right, Jill? One more, we'll give you a break. All right. All right, we're going to do the chin area. And some of the little veins that we were not able to get with the YAG, this head will also get those. You're going to come up on your nose. What we use with the laser is ultrasound jelly. 1, 2, 3. This is where gets a little kick there on the upper lip. So, ready? 1, 2, 3. You all right?
Yeah.
One more. Here we go. 1, 2, 3. Okay. We use the ultrasound jelly for the comfort of the patient and for the nice slip that it gives the laser. Here we go. 1, 2, 3. When you're getting photofacials, there is no exercising for 72 hours, no hot tubs, no hot baths, and no sun for 2 weeks, pre and post. Best time to do your photofacials is when fall comes around. Nice. Doing okay?
Right.
Fall is a good time because it's really difficult to put a controlled burn, which is what we do here, on their face and then put them out in 105 degrees. So fall, and if you're going to do them a month apart, if you do one in end of September, October, November, your skin looks great for Christmas and New Year's parties. People are like, if I get this, do I ever have to do this again? It's all about maintenance. Yeah, you're probably going to have to do, if not every 2 years, maybe every year, 2 or 3, depending upon how much sun you had in the past. It's critical to wear sunscreen, especially here in Las Vegas. I know that's kind of disturbing up there because it's. What do you think this feels like, Jill?
It's not bad at all.
Like a rubber band snap?
Not that bad.
Not that bad? And so what we would do is we would go over the skin for a second pass if the patient is responding nicely to the first pass, and she's doing really nice. Skin's starting to get pink. Afterwards you feel like you have a little bit of a sunburn. That evening you could put cool compresses on, maybe take an ibuprofen if you're allowed to take that, and the next day you can put makeup on and go to work. So today we did our advanced photo rejuvenation, photo facial for sun damage, background redness, or rosacea. And we did a microdermabrasion to open up the skin and allow the skin to be able to respond. And we did the YAG, which traces out the veins. And then we did the intense pulse light for the sun damage. So she will see it takes about a month to see the full extent of the results, and she will have a nice lightening and brightening of the skin.